Hello and welcome back. It's Jude from @Jude Reborn Girl. Today, I'd like to explore some of the things that you can expect to experience after a facelift. I've read hundreds of posts on Facebook and discovered that facelift patients are uninformed and truly in the dark about what they may go through after their surgery. Not all plastic surgeons take the time to explain what's to come after surgery ends. Or maybe they do tell the patient, but the patient is too nervous or distracted to retain the information. In either case, the patient seems surprised and concerned when certain things happen in the days and weeks after a facelift. So today, my goal is to review the experiences that you may encounter post-surgery so you are knowledgeable when you encounter them and don't become anxious, fearful, or freaked out. Knowledge is power. After surgery, most people say their face and neck feel tight. This is not simply due to the head wrap, which may be pulled tightly around the head and chin. This is an actual feeling of tightness around the lower half of the face and throat. Now, for me, I felt as if I was wearing a choker necklace. The choker sensation was most apparent within the first week post-op. After that, it did lessen a bit, and maybe I just grew accustomed to it. But by month 4 post-op, I only experienced tightness when I bent my head down towards my chest, which I tried not to do very often. You can absolutely expect to feel numb in various parts of your face, depending upon the procedures that you had done. A deep plane facelift and neck lift cause numbness from the face down to the jaw and back to the ear. In my case, I was also numb on the upper sides of my forehead due to my temporal brow lift. When you lose sensation, your skin feels different to the touch. Some say it feels like wood. Others say it feels rubbery or like cardboard. Well, it certainly doesn't feel like skin, that's for sure. This is all due to disruption of the sensory nerves, according to Dr. Joel Kopelman, a well-known facial plastic surgeon. In my case, numbness started to dissipate around weeks 5 or 6. By month 4 post-op, I did have 80% of my sensation back in my face. However, in some people, feeling can take longer to recover. It's really all about each person's immune system and overall state of wellness. Here's the thing. I took anti-inflammatory supplements to support my healing process. My surgeon, Dr. Jean-Paul Uzzi, stated that my recovery ran about 3 weeks ahead of the normal curve. So I chose to believe that the supplementation I was engaging in really helped me. Swelling begins to hit within 48 hours after your surgery. Most plastic surgeons say that swelling and bruising peak around day 5 post-op. At that time, your cheeks will puff out, giving you a chipmunk face. But don't be alarmed. It's a natural function of your wound healing process. All of your features may swell up and out, causing you to look odd or distorted. Remember, don't panic. This too shall pass. The swelling is a normal, healthy reaction to the surgery. Cold compresses help to reduce swelling and decrease inflammation, which in turn enhances recovery. Use bags of ice, frozen peas, or frozen gel packs to ice your face and neck. Swelling may not completely recede for many months. It can even take as long as 1 year. So be patient. Swelling does eventually go away. And swelling can be asymmetrical. One side or section of your face or throat may swell more than the other side. Again, no need for alarm. This is normal. It will all work its way out. Bruising may or may not play a big role in your recovery. Bruising may occur in the face or even on the neck and décolleté. It just depends upon what procedures you had. In my case, I developed some deep purple bruising on my face, around my nose and cheeks due to my lip lift. While studies indicate that most bruising goes away within 3 weeks, my bruises lingered for nearly 2 months. but I wasn't alarmed. I just covered them up with a full coverage concealer and foundation and went upon my way. No big deal. Please note, if you had fat grafting, you may also develop bruising in those areas. My research indicates that plastic surgeons recommend warm compresses for bruising to encourage faster healing. Normal bruising dissipates within about 3 weeks. But again, it can depend upon what procedures you had and the technique that your plastic surgeon uses for the cutting and the stitching. There are a number of variables that impact the amount of bruising that you may develop. As I scan posts online by recent facelift patients, I frequently see concerns about small lumps, bumps, nodules, and irregular skin texture on the face and or the neck. While this is something I did not personally experience, my research and interaction with other facelift patients indicates that this is a rather common temporary phenomenon. Normally, the cause is swelling. Other causes can include small blood clots, stitches gone awry, inflammation surrounding a stitch, and or salivary glands. These tend to resolve gradually over time, but if you suspect something more, consult your surgeon. This is always the best course of action. Pain or a feeling of swelling in and around the ears is normal for the first few days after surgery. This is primarily caused by swelling. Also, during a facelift, small sensory nerves are cut when the skin is separated from the underlying tissues. As these nerves reconnect to the skin, they can become irritable and cause discomfort, such as itching, burning, tingling, or numbness. I found my ears to be extremely sore and tender when I was laying down, slightly elevated, trying to sleep. It was better once I no longer had to sleep with the head wrap, but my ears remained tender through month 2 post-op. My research indicates that the recovery of the nerves around the ears, on the face, and on the throat can take 2 to 6 months. But the uncomfortable sensations should diminish within the first month post-op. Truth be known, I feel that my protocol of natural anti-inflammatory supplements helped me move through the nerve restoration stage faster. If you want more information about my supplementation protocol, please check out this video that documents it all. Facial plastic surgery can certainly be considered a life event of sorts, and like any other life event, the memories and the emotions surrounding it vary by person. According to my research and interactions with actual facelift patients, the majority of patients experience a mix of excitement and anxiety leading up to the surgery. After the surgery, some people actually feel a sense of relief and peace. A sort of, well, that wasn't too bad sense of relief. They know that the procedure is done, and now they're just eager to recover and see the results. However, there is a segment of people who experience other emotions. Some doctors describe these emotions as post-surgery blues. Studies indicate that these can arise from the mix of chemicals the nervous system and the brain are exposed to during general anesthesia. Others say that the post-surgery prescription pain medication plays a role in these mood changes. According to Dr. Diane, a plastic surgeon based in Reno, Nevada, after plastic surgery, the blues may present themselves in different ways, such as in bouts of crying or in a heightened state of emotional sensitivity, or through persistent or sudden irritability, or with feelings of doubt and regret about having had the surgery, or through anxiety about the recovery and the outcome of the surgery, or through a sense of loneliness and a feeling of missing one's normal routine, or a sense of confusion about feeling sad when one had hoped to feel happy and excited. Now, all doctors stress that the post-surgery emotional roller coaster is fairly normal and is not something to be concerned about. As you may know by now, I underwent 5 facial plastic surgery procedures under local anesthesia. That is to say that I took Valiums as instructed, and my doctor used numbing injections to keep me completely free of pain during the procedures. I fell asleep, and I slept through the entire procedure. Upon awakening, I saw my reflection in the bathroom mirror, and I was shocked and joyful. And for more information about that amazing moment in time, make sure that you watch this video, which explains it all. After my surgeries, I felt relieved that it was behind me, a little tired from all of the excitement and nerves building up to the surgery, and extremely happy that I could now relax and recover comfortably in my home. I didn't feel sad or irritable. Mostly, I was super curious as to what I would experience the next day, the next week, and the next month. But if you are feeling a bit down, anxious, or sad, know that it's okay. Part of the experience for many. And just try to go with the flow. Allow your emotions to cycle through and out of your system. Try to rest, relax, and put your energy towards healing. Nurture yourself with music, soft foods that you love, and all your favorite movies. Let your body recoup and recover. According to Dr. Cocker, a plastic surgeon in Dallas, Texas, the addition of any type of eye surgery, such as a blepharoplasty or an eye pinch, or the addition of fat grafting anywhere on the face, will extend your bruising, swelling, and recovery time. So keep that in mind. And I'm a good example of this. I had 5 procedures during one surgery under local anesthesia. I had a deep plane facelift, neck lift, lip lift, temporal brow lift, and a slight upper bleph bilateral revision. And my bruising took approximately 2 months to recede completely. So do keep this in mind and manage your expectations realistically. Having said that, the American Society of Plastic Surgery's online blog states, and I quote, that after the 1-month post-operative mark, you should be back to doing normal activities and enjoying life with your new look. It can take up to 1 year for very minor swelling, bruising, tightness, and numbness to fully recede, but those typically are only noticeable to you. So remember, your recovery is unique to you. You may or may not experience all or most of the sensations that we described in this video. Do not compare yourself to another. Just use the anecdotal information to keep yourself prepared and sane, and to provide perspective as you move through your own recovery journey. Try to roll with the punches and enjoy your personal metamorphosis. You are transforming. Embrace your new enhanced self and bathe her in self-love. Remember that having a facelift is sort of like winning the lottery. So many want to feel and look refreshed after their midlife, but only a small percentage can actually make it happen. You are in that blessed group. Count your blessings and be excited. The best is truly yet to come. Thank you so much for watching this video. It's Jude signing off. I hope that you will take some time to like, share, and definitely subscribe to the channel. We are working very hard to build the channel and expand it. So please, please, please do tell your friends, neighbors, and coworkers about @JudeRebornGirl. Thank you, and I'll see you on the next video. Ciao, guys.